ఇవ్వనక్కర్లేదమ్మా. 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
Hello and greetings from your host Varsha Singh. This is Healthline on TVAsia Telugu channel. In this show, we bring you physicians, healthcare providers that are here to provide you with very important health information. Healthline is just like a helpline, but not really a helpline. It's an information line about your health. It's my great pleasure again to bring you another Sathi physician. Sathi, South Asian Total Health Initiative. The aim and goal of this non-profit professional organization and the members of this group is to provide you education about your health and help you to improve the quality of your life. Our guest today is an infectious disease specialist, but not just any ordinary infectious disease specialist. She caters to a very special group, pediatrics, our children. Dr. Amisha Malhotra is an infectious disease specialist, especially for children, a pediatric infectious disease physician. She wears many hats. She works as a physician. She's also an assistant dean in the ambulatory care setting Pediatric Infectious Disease Center. She's also an associate professor at Rutgers Medical School. Dr. Amisha Malhotra works at Sathi as a volunteer physician, and her interest is in global medicine, especially where the infectious diseases are concerned. She has visited country and worked in countries like Botswana, South Africa, Kenya, and India. And with Sathi, she is working on this important project of tuberculosis. I can't wait to speak to her because today she's going to talk about and provide her expertise on travel medicine. Yes, we know we are not traveling as much among COVID. And at this time, it's really important to understand why travel medicine is very important for each of us. So please welcome with me, Dr. Amisha Malhotra.
Thank you, Varsha. Thank you so much for that very elaborate introduction. So,
Dr. Malhotra,
today.
Thank you so much for joining us, and thank you so much for providing your time. I will begin with one very important question. What is travel medicine? Because it is not something very common that everyone hears about. And you being a specialist in travel medicine, you can tell us about what exactly it is and some more things probably which I have not said about you.
Okay, so that's a great question, a great place to start. So travel medicine really is a branch of medicine that specializes in diseases and conditions that someone can get during travel. So, sometimes we don't think of these things when we're thinking of where we want to go. We don't think of getting sick. You just want to enjoy your trip. And one of the things that travel medicine doctors like myself and other infectious disease doctors do is we talk about prevention, because prevention really is the best medicine. So, when you're buying your tickets and you're booking your hotels, it's also a good idea to talk to a travel medicine doctor prior to traveling. And I recommend that you see somebody about 1 or 2 months before travel. They will give you some very helpful advice, because the last thing anybody needs is to get sick or have someone in the family get sick while you're on holiday.
Thank you so much, Dr. Malhotra. Many of us who love to travel have not thought of travel medicine to begin with. And this travel medicine has become really important now that we understand that there are many, many diseases that can be transmitted, that can be, someone can get it just by being in that closed space, or probably not just being in a closed space, but also just visiting a different country, and they may not be immune to that. And today, when we are looking at the scenario of COVID-19, and we understand that not many people are opting to travel, but there are certain circumstances where people may need to travel. So, what would be your advice for those circumstances where people will have to make plans and they will have to travel?
Right. So I think the first thing is remember, especially these days, there are travel advisories that come out. And these advisories are issued by the US State Department. You can find, anyone can Google this and find these advisories on the CDC, or the Center for Disease Control and Prevention's website. That's www.cdc.gov. So these advisories are based by country. Is it or is it not advisory to go to these nations? And so when you think about travel advisories, there are notices that come out. And it has to do with the general safety in various foreign destinations. And these advisories help us decide, is this a good time to travel? Is this not a good time to travel? Maybe some illness is going around, maybe some virus is going around. So that's what these travel advisories do. It's not just for illness, though. Sometimes there's civil unrest. So these travel advisories come out for a variety of reasons by the State Department. Now, currently, I can tell you that there is what we call a level 4 warning. Level 4 advisory for people from the US traveling to South Asia, that includes India, Pakistan, Nepal, Bangladesh, all of South Asia. They are saying avoid all travel. That's what level 4 means. And currently, this is a level 4 warning. Okay, so what they're saying is, if you don't have to go, please do not go. And it's really asking individuals not to travel. So that is the current state. And again, these advisories are updated very frequently. And then you go down to level 4 is the highest level. Then you go to level 3, where they may say you can travel, but if it's non-essential, then there's level 2, and level 1 means it's fine. Okay, so right now the warning is a level 4 warning. We are asking people to avoid all travel, and especially to postpone travel, including essential travel. So I'm talking about, there's especially certain people at increased risk, and those are our older individuals, and it's all because of COVID. They're older individuals, again, adults 65 or older. 8 out of 10 US deaths are reported in that age group. People with underlying medical conditions, diabetes, high blood pressure, cardiac, those people are at higher risk for severe disease with COVID. So especially for those, but right now we're telling everybody to avoid all travel because we are at a level 4 warning.
Dr. Malhotra, thank you for sharing such an important information. We all know that right now we are focusing on COVID-19. We are focusing on our travel advisory. However, in your specialty, there are so many other communicable diseases that we should be focusing on. And it is not just COVID-19. Right now it is COVID-19. But other than that, the travel advisory has been in effect for many, many other diseases for a long, long time. And not many travelers are actually using that. I really want your expert opinion on that, that there are so many other conditions where these travelers need to focus. Right now for COVID, we know that you mask, you wear a shield, you make sure you wash your hands, but then your focus should not shift from just one disease and you blank out all other diseases, because they are equally important, that there is possible transmission of those communicable diseases as well. And I'm bringing this kind of a shift of topic from COVID-19 to other diseases because your experience and your work with other communicable diseases, which are equally important. We cannot shift our focus from them as well while trying to protect ourselves from COVID-19.
Sure.
I really want you to take it away and talk about your experience, your work with Sati about tuberculosis, your visit to those countries where you went and you worked. That will really give a great insight to our viewers.
Sure. So I think the bottom line is, what can we do as travelers to protect ourselves, our families, and others when we're traveling to foreign countries and to other lands? And, being Indian, I mean, we don't think of India as foreign, right? This is home. And we just want to go home. We want to visit relatives. We're not outsiders. We're just going home. But the fact of the matter is when you've been living here in the United States, your immunity to a lot of the common things that you have seen growing up in India is waning. So there are things that you may have remembered as a child. You had dengue as a child, or you had malaria as a child. That immunity, the longer you are away from the country where you're constantly being exposed, that immunity wanes and you are no longer immune. Okay, so you are again as high risk as anyone for getting those travel-related illnesses, and that's why it's especially important. I think our mentality is, if I am South Asian, I'm from India, I'm from Pakistan, I am genetically immune to all these other things. And I'm immune to hepatitis, I won't get it. But the reality is you can and you may, and especially your children who may not have been born there or may not have had that frequent travel or that exposure that you've had. So it's really important to understand that when you're traveling, you're living abroad and you're traveling home, you really need to take precautions. As a matter of fact, what we find is people traveling back home are the ones at higher risk for travel-related illnesses, not those that are traveling for holiday and for purposes of vacation travel. But those that are traveling to visit friends and family are the ones that come back with travel-related illnesses. So this is the group of people I'd like to talk to, because I think, like I said, we just don't think that there's any danger, or we don't have to take all the precautions that we're used to taking. But I will tell you that there are illnesses that you can still get, not just you, but your family. So you still have to be very, very careful and very cautious. I mean, I have so many families that after they travel and the child comes back or the parent comes back with cholera or typhoid, they say, I wish I had known. It ruined our whole trip. So what are the vaccine preventable diseases? And of course, we discussed COVID, right? So COVID is not vaccine preventable yet. We're still waiting on the vaccine, but that is, again, a travel related as well as a US related. So wherever you go, you have to be careful and protect yourself. And how do you do that? You want to stay at least 6 feet away, right? You want to wear a mask, you want to wash your hands, and you want to avoid contact with anybody who's ill. And of course, you don't want to travel if you yourself are sick. I think some of these are very common sense. Remember, airports, bus stations, train stations, rest stops, they're all places that travelers can be exposed to the virus in the air and on surfaces. And also these places are hard to socially distance because they're so crowded, right? So the longer you're around somebody with COVID, the more likely you are to get infected. So having said that, and I think we've all heard this so many times, you need to stay 6 feet away, you need to wear a mask, you need to keep your nose and your mouth covered, you need to wash your hands. And we tell that to our children as well. And those are common sense things that I think we all can do to protect ourselves and to protect others from COVID. But when we get to other travel related illnesses, Varsha, as you mentioned, there are a couple that, we have to be conscious of because we don't really see a lot of it in the United States. And I'm talking about typhoid. I'm talking about cholera. I'm talking about malaria. I'm talking about dengue, Chikagunyq. These are other travel-related illnesses that we don't really see in the United States. We see them abroad. And of course, that's not to exclude other things like hepatitis and polio and measles and flu, those type of things. TB also, that's another related illness we need to be careful about. So this is the reason why I think it's very important for those that are considering travel. And I'm sure in the future, as our situation hopefully stabilizes, people will start thinking about traveling. But this is the rationale and the reason why it's important to seek advice from a travel expert or somebody in this field, so they can give you proper instructions and advice on what precautions should you take. And I'm going to go through some very simple ones. Number one, get vaccinated. There are certain travel-related illnesses that can be preventable, right? Typhoid, for example, there's a vaccine. That may be something you can avoid. Hepatitis B, hepatitis A, there is a vaccine. Okay, things like polio. Make sure you're up to date on your vaccines. Measles, mumps, and rubella. Make sure you're up to date. Influenza. So flu. We have chickenpox, for example. So all of these, pertussis or whooping cough, these are all vaccine preventable diseases that can be prevented by appropriate immunizations. So that's why, number one, it's very important to visit your doctor, and really not the week before, but at least 1 to 2 months in advance. Why? Because that's how long it takes some of these vaccines to take effect.
That's actually a very good point that you said, that don't wake up at the last moment. You really need to be proactive and prepare a little bit in advance. Many travelers who are, and I think you said it in the beginning of our interview, that as soon as you are making the travel plans, you should be making plans to visit your physician so that you can take proper precautions. You mentioned a lot of vaccines, and as in my experience as well, some of the vaccination starts from childhood, since we are children. Measles, mumps, rubella, polio. So there is a protection and immunity, while some of the disease that you mentioned, typhoid or hepatitis, they need to actually go back to the physician, and they need to just make sure that they are up to date with those vaccines. While we are talking about the immunity, developing immunity, and having all this immunization, protecting ourselves, creating a kind of a protective shell around us, the immunity shell. I also want to ask you this very important question, which is really time pertinent. Right now, everyone wants to know that. And you know what I'm going to ask you. It's about COVID-19 vaccine. As a physician, as an infectious disease specialist, what would you say to our community members?
Please get the vaccine. I got mine.
Yes,
I got mine. That's all I'm going to say. And look, I think, and people get very nervous. Oh my God, they came up with this thing in just a few months. No, they came up with this thing. It's possible. It's possible because it's a global pandemic, but it doesn't mean you cut corners to get the vaccine. So I can assure you that appropriate steps were taken, and there is a whole litany of things that have to happen in the United States to get vaccines approved and so forth. And the FDA and all the research that has to be presented. So this vaccine was developed because there's an urgent need. Funds were drawn in because there's an urgent need. Appropriate steps were taken. There are over 40,000 people in clinical trials. that were looked at for side effect and efficacy. And right now, I think last I heard, over 300,000 people have been vaccinated. So, of course, we're going to hear about post-vaccination experiences, right? But we already know what are the most common things with any vaccine: pain. And I can tell you, I felt that. I mean, I had a sore arm for a day. Some people may get a low-grade fever. Some people may get headaches. This is a 2-dose vaccine. I'm waiting to get my second dose. I've gotten my first one. It's a 2-dose vaccine. So, and it depends which one you get. One is you get the second dose after 3 weeks or 4 weeks, it depends. And there are some, very, the side effects that I spoke to you about, the common ones. But all in all, I think, because this is a pandemic, I think it's the duty of whoever can get vaccinated to try to not just protect themselves by getting vaccinated, protect their family members, and protect other people who can't get vaccinated. Because the whole point is, the more people we vaccinate, we are creating what we call herd immunity. So the more people that get vaccinated, the less this virus has a chance of attacking. Okay, and hopefully, if we vaccinate enough people, maybe 80–90% of the population, this virus will eventually just fade out. So I think that it is vital, if the vaccine is offered, it's important to think about getting the vaccine. And I think the rollout is going to be based on need and high risk. Okay, so right now it was healthcare providers, frontline workers, hospital and medical staff and those kind of workers, anyone working in hospitals, nursing homes, et cetera. But we are starting to roll out to high risk and eventually the public. So it is happening. And I would say I would take full advantage and get myself vaccinated if you can.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
It's very reassuring, and I believe that this kind of reassurance is required right now, especially when there is a lot of ambiguity and uncertainty. So thank you for sharing your own personal experience. Immunization, which is effective and less risky, and it removes a lot of fear associated with this vaccine. So moving on to another aspect of infectious disease, I would like to ask you more about your experience with your work in Botswana and Kenya and South Africa. If you can share a little bit about that.
I think living in the United States, growing up here, going to school here, medical school here, it really is a privilege for someone like me to be able to go to countries where there's a need for physicians, for medications, for doctors, and to learn and try to help those people. So it's really a two-way street. I went to Africa. Yes, I offered services, but I learned a lot in return. So for me, it was really a wonderful experience. I've been there a couple of times. I actually have family there. My first experience with Africa was at a very young age because I would visit my grandparents and my aunts and uncles there. And then you learn about, how the other world lives and what we take for granted. And our healthcare system is something we take for granted. And, and same in India. I mean, we realize there are those that don't have that luxury. So that's what took me to Africa a couple of times. And really what I have done is done more with HIV in pediatrics. So, pediatric HIV is, Africa is still combating with, especially South Africa and certain areas of Africa, with children and adults infected with HIV. So some of the work that I did there was really teaching prevention, also teaching or showing the doctors there our experience with antivirals for HIV and how we use them and how what we did to help our patients here. And hopefully, as at that time, the governments in those countries were rolling out antiviral HIV drugs to their populations. And so a lot of it was, for us to help them show them how we treated patients. And then, it wasn't just HIV. I mean, you go to developing countries and you see things like malaria, you see meningococcal, you see meningitis, you see dengue, you see typhoid, you see tuberculosis. I saw a lot of TB. Like I said, it was a learning experience for me, but it was also to understand that these diseases exist. And living here in the US, sometimes, we may not be exposed to all of this because, we have taken measures to prevent these illnesses here in the United States. But overseas, this is still a reality. And then when we're visiting friends and family overseas, these illnesses are around, and it's very important to take the proper steps to prevent you or your family from getting ill. So what I learned from them, I brought back, and I share that with my students. I share that with my patients. On how to diagnose patients, but also how to prevent these diseases, I think is key, because if prevention is really the most important thing. And so I enjoy doing travel medicine, and I enjoy global health for the reason that there are steps we can take to prevent people from getting ill from some of these illnesses. So, for example, malaria. I mean, I saw a lot of malaria in Africa and India, and, some people just don't have the means to take the medication. They would come to the clinics and would be able to give them the medication, but you can actually prevent malaria. You don't have to have it. It's just taking an anti-malarial. And I talk to families about that, and they say, oh, when I reach India, I'll just buy something there. And I get a little nervous because I know you can find something cheaper there, but I don't know the quality of what you're going to find. So the concern is always, if you can get it from here, you know the quality of what you're receiving, take it with you. And again, the need to see your doctor prior to leaving, so at least they can prescribe something with you, and have all your prescriptions filled. Not just the malaria, but if you take hypertensive medication, if you take diabetes medication, it may not be a bad idea to have those prescriptions filled here in the US, because I think you may have a better chance of knowing what you will get. Again, I'm not saying that the medicines you receive in India are not as good. I don't know that, but at least here, this is something you've been receiving on a daily basis. So to be safe, I think it would be a smart thing to do. The other thing, the other things I would see a lot of GI illnesses, a lot of diarrheal illnesses from different bacteria. For example, typhoid is salmonella, all these different bacterial intestinal illnesses. So how do you prevent that? Well, we have to learn to eat and drink safely. You go home and immediately the thoughts of, oh, I want to go here, here, and here and have this food and have this food and the street foods. And it's tempting. But
and sometimes it's nostalgia. I want to go back to the same restaurant. Right?
Absolutely. Absolutely.
Like I want to go and have some street food like I did it as a child probably years ago. But it's not the same.
I can tell you my experience. I remember as a young child visiting my family in India and with my cousins. Yeah, I was very young and there was a Golgappa guy down the street. And I went with them. Oh yeah, I'll have some. My parents didn't know this. Of course, I got sick with hepatitis. So, my cousins were fine. They lived there and I got ill. So I can tell you that it's very important to be cautious. You want to try to avoid street vendor foods. The best is the home cooked meal, the hot cooked foods, anything hot, anything cooked. Avoiding the raw fruits and vegetables. If you're going to eat a fruit or vegetable, you peel it. Whatever fruit you can eat, if you can peel it, you can eat it. But if you wash it with that water and it's not, water from a tap, I'm not so sure that's the right thing to do because again, that water may be contaminated. So if you can peel it, you can eat it. That's kind of my motto when it comes to fruits when I'm traveling. Vegetables, all of us will cook.
That's a great tip. Peel it.
Eat it. If you can peel it, you can't avoid it. And then drinking beverages from cans or sealed bottles. I think that's very important instead of the raw tap water. Be very careful with those sealed bottles because I've seen some interesting techniques where they use wax and all this stuff.
Yes.
It really has to be pretty authentically sealed and not something that looks like the seal is broken, or you boil the water or you chemically treat the water. But that's how we prevent those GI type of illnesses because those are pretty frequent in travelers. We call them traveler related diarrhea.
That's diarrhea.
Yeah. And, sometimes doctors will also prescribe antibiotics for you to take with you to prevent that kind of diarrhea. I don't like to do it for children because I don't know what the child has, but some of the adults, can carry it for themselves. So that's another thing, another reason to see your doctor prior to travel.
Actually, I think you just pointed out the biggest worry of moms when they are taking their children abroad, when they're traveling, what to give them, what to feed them. And most of the time it is probably the boxed food. I have heard mothers carrying the boxed milk boxes so that children can have it, non-perishable milk boxes.
Yeah.
I heard of travelers carrying Brita filter and Clorox tablets. So are they equally effective if they want to have the filter and all those tablets, or you would say just boil it?
I would say boil it. The one thing, boil it because those filters are good, but they're filtering out particles. They may not, those microbes, salmonella are tiny, and those filters may do nothing for that. But if you boil the water, you're killing it, and then you cool it. So it's really, but I mean, there are certain chemicals like iodine has been used. I don't know if I would actually use some of the chlorine tablets, but the question is to drink chlorinated. I mean, it doesn't taste right, and these kids may reject it. But if you boil that water and cool it down, it still tastes like water.
Thank you so much, Dr. Malhotra. I think it is relieving a lot of anxiety of a lot of people about drinking water when they are not sure about whether it is contaminated or not.
Right.
So I wanted to point out from your conversation that it was your passion for global health that brought you to Sati. If you can talk about, and you did lead the projects such as CDC Health Docker, a very popular project. And it's really something that I want our community members to hear about because it's almost like peer education, and that has great benefit. So I will let you talk about that project.
This is actually a lot of fun. A few years ago, Sati was actually approached by the CDC, and I alluded to this a little earlier when I was talking, but basically what the travel branch at the Centers for Disease Control and Prevention found was they were seeing an uptick in the number of cases of diarrheal illness or typhoid fever, especially typhoid, on returning travelers from South Asia. And so they contacted us and they said, how do we get the word out that there is prevention available? Because we're seeing an increase in travelers from South Asia coming back, after visiting friends and family, coming back to the US and getting sick with things like typhoid and hepatitis A. And so that's how the conversation started. And so we used a company actually called Health Talker to help with this project. And the project really was to have a discussion among our community members, our community leaders, about prevention when you go overseas to travel. So we had done a survey about, how many people would actually do that. It was a bunch of questions on the survey about, we would go, I know our surveyors went to Edison, and they went to various melas during Diwali, and they would just ask people, when you go to travel, what do you do? Do you take medicine? Do you do any of this? And it was interesting. We did it before, and then we implemented this Health Talker where we got people to educate communities. And then we did the survey after. And what we found was people really were not inclined initially to see their physicians. They thought it was very safe just to pack up and take off and not, because they were going home. And, why bother with seeing the doctor or getting any medication or getting any vaccines? And then once we implemented this program, which was really by word of mouth, I talked to two friends and I tell them, hey, listen, I went overseas and I went to my doctor and I got my typhoid vaccine and I also got medicine for malaria. And then that person goes and talks to 2 or 3 other people. And then that person we found that word of mouth helped educate the community. And that's all we're trying to do, is get the word out. Because when you hear from the CDC that people that are living in the US are going back home to South Asia and visiting friends and family are coming back ill, you want to do something. And you want to educate them and say, this is preventable. And you may not realize it, but there's something you can do to prevent yourself from getting sick when you come back from visiting friends and family at home. So that's what our project was. And it was interesting that our post Health Talker survey showed that people really did have at least more knowledge of where to go, who to talk to, what the CDC website was, that they can talk to their doctor about their travel plans. And, I think sometimes we're very good about taking our children to get their shots. We're very good about keeping our appointment with our doctor for our diabetes meds, for our blood pressure medicines. But when we're going overseas, we don't think, hey, I don't need to see the doctor. I'm just going home to visit family. But I think it's very important that we communicate to each and every one in our community.
Thank you so much for talking about CDC Health Talker. Because I'm going to reach out to our viewers and just say the same thing. You need to talk about this show to your friends and families because this is great information. So Dr. Malhotra, moving forward and asking you another question about protecting ourselves. And you actually made a really great point, not once, but twice in this conversation about making sure you are taking your blood pressure and diabetes medication along with all other medication that you want to protect yourself from malaria or typhoid or hepatitis. Because your approach is holistic, that if you are not taking the other medications, you are reducing your immunity again by just allowing the other disease not being managed well. So that's actually a great advice, that don't just think about one aspect of your health you talk about, think about the holistic way of keeping your body safe and protected. So at the conclusion of our interview, a very interesting conversation, Dr. Malhotra. I'm sure our viewers are really taking a lot of points home. What would be your message to all our viewers who's watching this show right now, getting some important advice from you about travel medicine, which may be new word for a lot of viewers? What is your take-home message?
You're talking to someone who loves to travel. If I could, I mean, this year was very difficult because my family and we usually love to go away and see new countries and, go abroad and visit. It really, it was a tough year. And I know it's a tough year for everyone. So they're listening to this program saying, what is she talking about? Who's going to be traveling? But there will be a day. I'm hopeful there will be a day when we will be able to go and visit those that we haven't been able to visit, just Zooming with them or FaceTiming. And so I think the best advice is, when you go away, you want to enjoy yourself. You don't want to think about getting sick on a trip. But the reality is, if we don't take the precautions, that may happen. So it's just as much as when you go and you buy a ticket online and you book your hotel and you book your flight, make an appointment with your doctor. I think that is the best thing you can do for yourself and your family. And just let them know, listen, I'm going away. I'm going to this place. Do you think I need to do something extra? What should I do? And if they're not sure, they call us. That's what we're here for. That the ID doctors, we're, at Rutgers, I mean, they can call us. And otherwise, just trust your doctor. Or you could call us directly. I mean, you can come to the ID clinics and if you have questions. But really, I think on your checklist of your travel plans is, let me buy my ticket, let me arrange my hotel room, let me do some shopping. Don't forget to put in there, let me call my doctor. Taking those precautions really protects you, protects your family, and it protects your trip. Because the last thing anybody needs is to get ill when you're away for a very short period of time. We can't go for months and months. We only go for whatever it is, 14 days, 21 days, whatever it is. And if you're sick for half that time, you haven't enjoyed that trip. So if there's anything I can leave you with is, please make sure you discuss your travel plans with your primary physician, and they can advise you, depending on where you are going, what or if anything more needs to be done.
Thank you, Dr. Malhotra. And I missed asking you this important question.
Yeah.
So if they want to get some more information and if they want to learn more about communicable diseases and how to protect themselves, because there are so many diseases and so many questions, what is the best information source that you would point your fingers to?
It's a source I use a lot, and it's www.cdc.gov/travel. It's very comprehensive. It's based on destination, so where you want to go, and it just gives you some advice on, this is what you need to look out for. This is, and again, these advisories are from the U.S. State Department. So, they'll let you know, look, like I told you earlier, we are at a level 4 for COVID. So please postpone any travel to India, because they're saying avoid all travel. And not just for COVID, but it'll tell you for malaria, it'll tell you for Zika, it'll tell you for Chikagunyq. So it's a wonderful website. I think it's very easy to understand. And I think it gives you a lot of good advice.
Thank you so much for this wonderful and very interesting conversation. I think our viewers have learned so many tips from this travel medicine presentation by you, Dr. Malhotra. And I know that when we all will start traveling, and I'm also hoping that it will be really in near future, we will get out of this. We are all in it together, so we will get out of it with a cumulative effort. Everyone is part of that. And when travel medicine is required, when the travel starts, our viewers will keep all these tips in mind. I want to thank you for your time and all those advices and sharing your experience with us. As a Sathi physician, I want to thank you for bringing that expertise to Sathi and sharing your expertise in this special Sathi series of Healthline. Thank you.
Oh, my pleasure, Varsha. Thank you very much. I enjoyed it.
We had such an interesting discussion with DR.Amisha Malhotra, travel medicine and pediatric infectious disease physician. If you enjoyed this episode, please remember what Dr. Malhotra said. You can be just like another CDC talker. Talk about this travel medicine to your friends and families so that they can also benefit by all the tips and advices given by our special guest today, Dr. Amisha Malhotra. I hope you enjoyed this episode of TVAsia Healthline on TVAsia Telugu channel, a special Sathi series. Stay tuned. Next time, I will have another Sathi physician sharing the advices and experience, just like our many Sathi physicians who shared their advices, information, expertise. For now, I will say bye till I see you again. This is Varsha Singh saying good night, good evening, good day, because everyone from all over the world watches this show at a different time. Thank you.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్గా ఉంటుంది.